Merhaba arkadaşlar. Bugünkü videomuz İngilizce olacak çünkü konuğum Pakistan orijinli Doktor Hoca Adnan Ahmed ve şu anda Galler'de Consultant Psikiyatrist yani uzman psikiyatrist olarak çalışıyor. Geriatrik Psikiyatri alanında ve pek çok yabancı doktorların yani IMG'lerin bulunduğu Facebook gruplarında daima IMG'lere çok yardımcı olan bir insan. Bana da çok yardımı dokunmuş bir insan. Ne zaman ona bir soru sorsam bana çok güzel rehberlik etti. İlk psikiyatri işime başvurmadan önce mülakatta neler sorulabilir diye danışmıştım. İlk o zaman kontağa geçmiştim. Daha sonra psikiyatri uzmanına başvururken eee, nasıl hazırlanmalıyım, girme ihtimalimi nasıl artırabilirim diye konuşmuştum. Yine yardımcı olmuştu. Daha sonra MRC Psych sınavları için yani Royal College sınavları için de çok destek oldu. Kendisi de İngilizce olarak IMG'lere yardımcı olmak için videolar çekiyor ve YouTube'da bu konuda birçok videosu var. Ayrıca İngiltere psikiyatri uzmanlığıyla ilgili pek çok faydalı bilgiler paylaştığı bir web sitesi de var. Umarım faydalı bir video olur. İyi seyirler. Hi, thank you so much for joining, Dr. Ahmed. Um, so I hope that most of you will know Dr. Ahmed is quite helpful to IMGs. He does lots of helpful videos. He has a very good YouTube channel that he has interviews with other IMGs. And also he has a very helpful website, especially for psychiatry training. And he helped me a lot in my psychiatry journey as well. So Dr. Ahmed, I know that you've been in the UK for long. Was it like how many years ago you came?
So I
Here.
came in 2005, right after my house job. So I'm a graduate of 2003, and I did an internship here in Pakistan, and then right after that I came to UK. So it's been more than I think 17 years now.
Wow.
Quite a long
Yeah.
time.
And you still look so young. Yeah. So, and Dr. Ahmed is a consultant psychiatrist specializing in older adults, and you work with inpatients, isn't it?
No, I have my
Both.
job plan is currently the job I'm doing is both inpatient and also the
Okay,
outpatients.
good. Yeah, we'll go into more details of your job. And have you been living in Wales for many years now?
Yeah, I think when I first came to UK, I came to Wales, but then I have to go to England to do some of my training. So I did my foundation year in Somerset, and then I did my CT1 in England as well, in Essex. Since 2009, I've been living in Wales.
Okay, good. So now, do you want to talk a bit more about your career path and CV a bit in more detail, if that's okay?
Yeah. So as I mentioned, I'm a graduate from Pakistan, and I did my MBBS in 2003. Then I did a year of internship. But around that time, when I was in final year, I was already thinking about lab and coming to UK. So right after my graduation, I started to read for my exams for English exam, which was IELTS, and I did that. And during my house job, during my internship, I was already doing the PLAB one. So I had the date of the exam, and I gave my PLAB 6 months into my house job. Then after that, by the time I was finishing my internship, I already had a date to come to UK for my PLAB 2. So in 2005, I came to UK as an IMG, as a young IMG, and I passed my PLAB 2 in the first attempt. And then after that, I had the attachment. I did an attachment in Wales, an observership post. And from that time onwards, I started getting jobs. I was doing non-training jobs initially. Then I finally got Foundation 2 standalone post, and that was in Somerset. And from that standalone post, I went to do the core training in psychiatry. And psychiatry was always my ambition, and I always wanted to do that. But my initial, when I came to UK, this is something I say to my other IMG colleagues as well, that you have to come with an open mind. If you want to do psychiatry, but if you're very young and this is your first job, then don't restrict yourself to just psychiatry. Initially, apply widely and see what else can you get, because you can always come to psychiatry training afterwards. But that's something you have to come with an open mind as well sometime. Then my core training during my core training psychiatry, I passed my MRC Psych exam, and then I did go on to do the ST training in psychiatry, which was in Old Age Psychiatry in Wales. So I came to Wales. I was already in Wales at end of my core training that I finished my ST training in Wales, and since then I've been working as a consultant in Wales. And other than MSc Psych, I've also done the MSc as well,
Mhm,
education from Cardiff. So that is something I did as an ST trainee.
mhm. Um, yeah, I want to go into detail about the MSc later on as well. Firstly, I wanted to ask, like, what was your main kind of thinking behind coming to the UK? In your mind, like, I know everyone has different reasons, but it's helpful to hear yours, if that's okay.
I think it was, as you said, everybody had different reasons. So when I was young, I had this mentality of exploring the world. I wanted to come out of my comfort zone and see the world and see another part of the world and see what can I learn from there, from here. Then I knew, or I found out from my seniors that the training was very well structured in UK, especially the psychiatry training. When I was training in Pakistan, when I was very junior doctor, the psychiatry training was not as structured as now. They have improved a lot as well. Uh, so psychiatry training was more structured here, and I felt that I need to explore other parts of the world. But the main reason I would still say was the financial independence, because when I was working in Pakistan, the wages we used to get as intern or even as a postgrad trainee were not good enough. Were not good enough for you to have even the basic comforts of life, like renting a good house or driving a good car. Those sort of things you couldn't do in those wages. So my main aim, you could say, that to become more financially independent, and that I think that's something that I achieved when I came to UK.
Mm-hmm. I see. And can you tell me about like pros and cons of living and working in Wales, because I don't know much about it.
So Wales is a part of United Kingdom. So if you look at the map, Wales is actually itself is a large country, but it is a part of UK. England is attached with England by land, so we are not an island separately to the English island. Um, and Wales is beautiful, in a sense that the landscape. There are only few cities, you say, and few big towns, but otherwise the rest of the Wales is quite open spaces, countryside with hills and waterfalls and streams and sea as well. So if you look at the map of Wales, the coastal side, which is the South Wales, have the most largest area of, you can say, bigger towns. Cardiff, Swansea, they're all on the south end. As you start going up to North Wales to Mid Wales, it becomes more and more remote. It is lovely. I must say the cost of living, as you said, we're asking what is the advantage of living in Wales, would be that the cost of living is cheaper than England. Certainly, the south of England, we have much cheaper houses here, and also I think the general population is very nice here, and I like to sort of interact with them, and they are very welcoming for the immigrants as well.
Okay, that's helpful to know. So, would you advise the IMGs to consider Wales then? Seems like you're happy
Yeah, I
there.
think yeah, I am personally, I'm very happy, and I'm living in a part which is not very remote, to be honest. I'm living near Cardiff, so and it's very well linked up to the English cities as well. Bristol is not far from us. The Heathrow Airport, for example, is only 2 hours drive from my house. So
Mm,
we're not far from a
mm,
lot of the English cities and English
mhm,
landscape.
okay. And I want to ask a bit more about older adults. I'm doing my first older adult rotation, but I'm new. So, I just wanted to ask again the advantages and disadvantages of specializing and working in that field.
So old age psychiatry, as you know now, is a part of your training in psychiatry, and it's a subspecialty in UK. So it's not a subspecialty. You might not find this subspecialty in other part of the world. Like for example, in Pakistan, old age psychiatry is not separate from the main general
Same
psychiatry.
in Turkey, yeah.
Uh, so in UK, the old age psychiatry is basically based on patients who are above 65 and they're getting some mental health difficulties. And the large part of our job is for patients who are developing cognitive impairment, like for example Alzheimer's. So diagnosing them, treating them, keeping them safe. All of that is a part of our role. And sometimes, patients who have mental illness throughout their life, but then they become older, their needs increase in a way that they need more help with their physical healthcare needs. In that, the old age psychiatry is more specialist. So I would say, when people ask me why should I choose old age psychiatry, so I think old age psychiatrists have they are well-rounded up doctors, because they have knowledge of physical health as well as mental health, because our patients have frailty issues with multiple medical problems. So by chance, or by the way we work, we have to sort of learn about those medical conditions. And then, if you're one of those doctors who fear that by going into psychiatry I might lose my medical knowledge, I think then old age psychiatry is well suited for you, because then you will not lose that. Um, then I think old age psychiatry, because it's a specialism. There's some things which only old age psychiatrists can do. As I mentioned, to run the assessment for impairment of cognition. That is something we specialize in. Um, I mean, when you say why people won't like to come in old age, I think that is something some people will find that, again, they came to psychiatry thinking that they want to get away from the medical knowledge, and they might find it too overwhelming with the medical issues, and they might think that this is not what I thought psychiatry was. And sometimes, as you mentioned, that other countries doesn't have old age as a specialism. So people who come with the mindset that I want to come UK and then I want to train here and then go back to my home country, um, that they might not like the idea that if they specialize in old age, they might not be recognized in their own country so well. So they then do other subspecialties. So I would say that, I never try to sell old age as superior to any other specialty. I think all subspecialties of psychiatry are very interesting and very good, and very enjoyable. It depends on your personality. It depends on your your style, that which one you like. So it's good that during our core training we experience different subspecialties, and then we can choose one.
Yes, yeah, I agree. I mean, personally, so far, my initial impressions in older adults is, as you say, it can be a bit overwhelming sometimes, because they're quite complex.
Yeah.
But yeah, I'm still new to it, so we'll see how it goes later on. So can you tell me a bit more about your current job, like current weekly program, workload, that kind of?
So I'm working as you mentioned, the old age psychiatrist in Wales. So as an old age psychiatrist, as you were mentioning earlier, you will find some places in England, especially in England, but also in Wales sometimes, that you will have a split between the jobs. So some old age psychiatrists are only doing the inpatient jobs, only looking after the patient who are admitted, and while the others are only looking after the patient in the community. But in Wales, we don't have that split. Most of the time we are actually doing both of the jobs. There are still some places when you can do the split, but most of the time we are doing both. So my job is what we call uh, a consultant psychiatrist in old age, and I cover a catchment area, a particular catchment area. So all the issues of mental health issues of patients with older age happening in that particular catchment area, they will come to us. So my weekly plan would be, I have a ward and do ward round once a week. So I'll take you through my week anyway, so that will give you a better idea. So when we start the week on the Mondays, I have a outpatient clinic in the morning. In the afternoon, we do some MDT meetings. So MDT meeting is when all the team from the community and the inpatient get together, and we talk about the new referrals, and we talk about any issues, any risk issues, any patients which we are struggling with. On Tuesdays, I have my ward round in the morning, and in the afternoon we have our postgrad, which is uh, uh, every week we have this presentation from our own trainees. Sometime an external speaker come and talk to us. So there are 2 or 3 hours of training which we go through every week on Tuesday afternoons. Wednesdays is normally, in the mornings we have some important stuff like to meetings, which could be ward meetings, management meetings. That is Wednesday morning is specific for that. Wednesday afternoon, I normally do my admin work, but sometimes you are dealing with emergencies, patients who you have talked about in the MDT who needs urgent reviews. They are going into Wednesday afternoon. Then Thursday morning, I have my day for the home visits. So patients who can't come to see us in the clinic for any reason, I go and see them in their own homes. So for example, if patient is too frail or they're too low in mood that they don't have the energy to come to the clinic, so we go and see them at home. Sometimes I go on my own, sometimes I go with the psychiatric CPNs. uh, then Thursday afternoon is my outpatient clinic, and I'll see patients who will come to our clinic in my hospital. And Fridays are normally kept for the stuff which is left over, is spillover. That could be meetings from the wards which we haven't been able to fit in on the Tuesday. Sometimes Friday has some emergencies which we're dealing with. Mostly Friday I use for my supervision time as well. So I have trainees who I supervise. They will come to me on the Friday morning or late afternoon. So Friday is spent more flexibly, but the rest of the sessions are more fixed. I don't know if your viewers would like to see, because they might have seen psychiatry happening differently around the world. But in the community, as I was mentioning when I mentioned community, uh, by community, I mean that we have psychiatric nurses, we have occupational therapists, we have psychologists who work with us in the community. So the main aim is that we try and assess patients and maintain and manage patients in the community. If they can't be managed in the community, the idea is the best environment for a patient is their own house. For some reason, for due to risk issues, they can't be managed. They need to come in as a last option. They need to come in as in the hospital for admission if we can't manage the risk or they're too unwell. Or if we have managed somebody as an inpatient, we want to send them home, we will always have that community team to help them. So that is, as a role of psychiatrist, so it's not just about admitting patients and seeing them in outpatient. We also manage a big caseload which is based in the community. At least 30 to 40 patients under community mental health team is being managed in the community.
And can I ask, when you do your outpatient clinics, for example, Monday morning, you said, and you do home visits, so how many per day usually?
So depends on the type of clinics. Sometimes if we are seeing new patients, the new patients require more time because they haven't been seen before. So that the history you take is more comprehensive. So that for that we'll have a slot for at least 45 minutes, sometime an hour, so that we can only fit 4 patients in that. So 4 new patients if you are doing an assessment. If it's a new patient clinic, if it's follow-ups, then again follow-ups are divided into 2 different types. We are still doing some phone follow-ups as well and some face-to-face follow-ups. That could be between 6 to 8, depending on how much is required.
Okay. So, for example, if you're doing Monday morning clinic, you might see up to 8 patients, you say? If it's
Yeah,
follow-up.
we try not 8 is like a maximum,
Yeah.
you can say maximum. We try and see around 6. Sometimes, I keep some slots empty for emergency. So if somebody was struggling in the community, by psychiatric nurses can ask me to see them in emergency. So those slots are not always filled. So it's try and keep 6 for the routine ones and 2 if there is any emergency.
Okay, I see. And again, with home visits, I guess you have to think about travel time. Do you, how many you
So
see?
home visits take longer, as you said, it's a travel time. You have to get to patient's house, you have to find them from sat nav. Then it can take longer. So a new patient home visit again can take about an hour because you have to take a comprehensive history. The the the follow-up visits can take half an hour if you really know where you're going. Sometime again you have to add the travel time, because sometime in between the home visits you have sometimes 15-20 minutes of travel time. So I try and do 2 or 3 home visits in one morning when I do.
Yeah, I see.
If it's a new patient, then I'll do 2.
And in your ward, how many patients you have? How
So
many?
our ward is in old age psychiatry. We have 2 different types of wards. So the ward I am working with patients who have memory problems and behavioral symptoms of Alzheimer's, for example. Um, so we have the ward we are wearing is 18 patients. But then they are something called a functional ward, which are separate. So patients who have, for example, suffering with depression, anxiety, schizophrenia, OCD, all the other functional illnesses, they will go to a functional ward. And my ward currently is not that it's not for functional patients, for only for patients who have memory problems.
And are you the only consultant in that ward?
No, no, no. I
Oh,
am
okay.
one of three.
Okay. I was wondering how you can see 18 patients in one day. So you don't have to see all of them on your
No,
Tuesday.
normally I have 6 or 7 under my
Okay.
name.
Okay. Yeah, that makes more sense. I was like, how are you doing all these
No,
work?
I have managed in my previous job. Under my previous job, I was managing a 15-bedded ward on my own,
Oh,
and
wow.
also I had community work as well. All of this, 2 clinics, MDT, home visits, and then I have 15-bedded ward
Yeah, it's
as
a
well.
lot
So
of
it's
work. And how
it is
many
well.
trainees you supervise?
So we have a CT2 based on our ward, who covers our unit, and then we have a physician associate as well. So there are 2 people who we get directly in contact with. Then for education supervision, I have 2 as well, again separately, and SPR.
Yeah, that will take quite a lot of time as well.
Yeah.
Like, you have a quite busy job. Yeah,
Yeah.
yeah. So how, like, do you feel you have, would you say you have good work-life balance in working in where you work now?
Sorry, can you say that
Yeah.
again?
Would you say like the work-life balance is good, or do you think it's too much? Like, what do you think?
No, I think work-life balance is good. I think you mentioned, work-life balance is very important, and that is something you work shouldn't really. You should work hard. You should work with all your energy and everything. But you also need to realize that you have life outside work as well, and your
Mm-hmm.
family. So as I go to work on time, and I give my full energy, full concentration, and attention. But I don't stay longer than what I'm supposed to.
Yeah. So
So
you
it's
don't have
nine
to
to five.
do much overtime, I hope.
No, this
Okay.
9 to 5 job, and we're normally able to finish our jobs unless very rarely, very very rarely, you have dealing with an emergency that you have to stay back.
Mm.
But it's 9 to 5 job, and then you
Okay.
get the 2 days off. You get Saturday and Sunday off.
Yeah. And do you do any on calls as well?
Yeah, on calls we do, but on calls are, as a consultant, the on calls are
Yeah.
less frequent. As a junior doctor, you do
Yeah.
much frequent on calls. So my on calls, I'm on rota one on 24, so it's after every 24 days, you can say 22, 24 days. Once a month, I'm on call one day a month.
Okay. I see. Um, Now I wanted to move to like your tips that you want to give to people who are new to psychiatry or who wants to start psychiatry, because I know you helped me a lot with these things. So
Yeah.
I thought I'll ask you for this audience as well.
So you mean the people who want to start psychiatry, or just starting it, or they have
Mhm.
made up their mind?
Uh, I mean, mostly, I would say like who wants to work in psychiatry. Yeah, let's start with that. Like people who wants to
Yeah, I
want to
think
go
it's
into
a so as you said, psychiatry is a very good specialty, and unfortunately, there's a lot of myths around it, and because of those myths, well, myths are spread by people who haven't worked in psychiatry themselves, but they just keep saying negative things about psychiatry and mental health. Not just about the patient. There's a myth, a stigma against the people, the psychiatrists themselves, as well out there. Very commonly, you will hear that psychiatrists lose their own mind, they become mad. That psychiatrists, yeah, get attacked and assaulted very easily, and it's a very difficult and dangerous job, and all of those are myths, which are not true, and it's just said over and over again. People start to feel that they're real. uh, the first thing I think is to acknowledge that there are myths around, and if you come into psychiatry, you come with an open mind to test for yourself that what is it like. um, and then once you're in psychiatry, most you need to have some degree of interest in mental health as well. So you cannot come to psychiatry thinking that the workload is less here. So this is another myth. The workload is less, so I can just go there and relax. And when you come to psychiatry, then you realize it's actually actually have to need to do work. I need to use my mind, and then you feel suddenly that you can't do that. So you so this is another thing. If you are interested in psychiatry, you need to test it out. But testing it out, even if you're in home country, you go and spend some time in your mental health units, and go in some time with your local psychiatrist there. Request if you can go and attend their ward round. Request if you can sit in their clinics and see what sort of patients they're seeing and how they're managing. that will help to reduce a lot of anxieties which you have. If you're already in UK, you can do again the same thing here. You can contact your local mental health service to see if you can attend some of their activities to learn how they're doing, meet their trainees who are working there, and sort of learn from them as well.
Mm.
If you, I mean, if you have started in psychiatry and if you're new, I think I would say that you need to explore it a little bit more, in the way that you might be given a specific job. I see this a lot, that as a junior doctor you might just be given a ward initially, that you just need to manage a ward, and you might just think that my job is just to look after patients who have physical health and just clerk them and just write their drug charts, and there's nothing much going on other than that. But you need to, again, go with a mindset. Then you need to explore what else is going on, what is actually happening in the community. When I'm discharging these patients, where are they going, how they're managed, what is the community team doing, what is happening in the outpatients, what different kind of mental illnesses out there, and how can I learn about them, how can I learn about how to treat significant mental illnesses, how to risk assess patients, some understanding about the Mental Health Act, the mental health law. um, and one of the most important and interesting aspect of psychiatry, which actually attracted me to psychiatry, is psychology. You cannot work in psychiatry without reading psychology or understanding psychology. So humans, and reading about human psychology, developing some understanding about the psychopathologies. And psychopathology is kind of, you can say, is used for abnormal state of mind, but you need to first understand how a normal human mind works. How our emotion work, how our thought process work, how we learn things, how we act in certain situation, what are our common emotions, and what can go wrong if those emotions are not working right. Then you can read about the psychopathology, and then you will learn a bit more, and then your interest will slowly and gradually grow in that.
Mhm. Yeah, definitely. Thank you. Any other tips about like psychiatry training in general that you wanna share in this video?
So I mean, like psychiatry training, you obviously, this is a separate topic, that
I know.
how do you actually enter psychiatry. And so
Don't
most,
worry too much. I know we probably won't have too much time for that, but yeah, any tips that you feel like very important to highlight?
I think for psychiatry training, if you are interested in psychiatry, as I said, that's if you are starting the training, in UK, the training is quite formalized. So sometimes IMGs will struggle to understand what actually is expected of a trainee. So sometimes you just come with a mindset that it's just, I'll just have a job, I'll do the job, but then there are some other responsibilities, some other things you need to do. Like there would be program to teaching going on, and you will be expected to participate in in that program as well. Bring some complex cases there. There will be balance group going on, understanding what is a balance group and how to go about that, understanding the Royal College portfolio, then how do you go about that, understanding the role of a clinical supervisor, your education supervisor, and then also understanding the role of the MRC Psych exam as well. So I think those are the things which, if you are starting psychiatry training initially, those are the things you need to sort of get a hang of, get an understanding of. They might look very, very complex initially, but they're not that complex. Slowly and gradually, you will understand how to do it. And I'm sure as a core trainer, you understand that you need to develop some psychotherapy competencies as well, which is at least unique to more to UK, because I don't see this happening in other parts of the world that as much. That as a psychiatrist, while you are training a psychiatrist, you actually take up two cases, one long case and one short case of psychotherapy, and do them under supervision, and then get feedback on that. So those are sort of the important elements. But as I said earlier, the main important element is to understand the diagnosis of psychiatric illnesses, the common psychiatric illnesses, risk assessment, how to do risk assessment, and then how to treat those patients when they are under your care, for example, as an inpatient or an outpatient. What are the treatment options available? Biopsychosocial model, not just that you can prescribe them pills. What are the psychological therapies available? What are the social interventions you can do for them?
Mm-hmm.
Understanding all of that is very important.
Mm-hmm. Yeah, definitely. And a common question I receive, and I want to ask you because like Wales can be quite different, and I was wondering if you feel like there is a lot of racism towards IMGs. Like, did you experience that? So that just want to ask your opinions about that subject.
I think there's one thing to understand. People ask a lot about racism in UK, that do you actually face it because are different from the local population here. I think the first thing you need to say to people that racism being getting attacked as on a racist racism attack, is illegal here in UK to actually be racist towards somebody. If somebody is openly racist towards you, you absolutely can report them to police. You can report them to your trust, and that's an unacceptable behavior. But then people say that what if somebody is not openly racist to me, but they are trying to do things to put me down and undermine me, all of that. I mean, those things can happen. I'm not going to say that that does not happen, but overall, I would say that the environment here in UK is very welcoming to the international doctors. If you come and work in NHS, you realize how many how much of the workforce is actually international. In psychiatry, I'm sure you must have seen at least the areas I'm working in, at least 80% of the consultant level psychiatrists and even the trainee level psychiatrists, they are from IMG background. They are international medical graduates, mostly from India, Pakistan, other countries, Egypt. They're coming and working here. So there is already, I don't think I've never felt going to hospital that I am an alien, that I'm not, I don't shouldn't be here. I've always found that people like me were already working there, and they were already working in a comfortable zone, and they all always helped me in understanding the culture and understanding the norms of that particular area. And I personally, I think Welsh population is very good. I don't think I've ever faced any blunt racism here, to be honest with you.
Mhm.
And they
And
are very welcoming.
when you said Welsh, do you struggle with the accent, or is there any patient that they don't speak English because
No,
they're
no,
Welsh?
that hasn't happened. Welsh language is still there, but very few people speak the language, and I haven't come across a patient can who cannot speak English. So they all
Okay.
can speak English. That's not a problem.
Cool.
And accent is actually nice. It's not as thick or as complicated.
Mhm,
When you come here within a month or so,
mhm.
you will be good at understanding what people are saying very clearly.
Okay. Do you need to learn any Welsh to work there? Or
No, no,
no, you don't need to.
we
Okay.
learn kind of no, we learn few words obviously because uh, of you keep seeing them like welcome and what the hospital is called and goodbye or thank you and all of that. But
Mhm.
that's about it. It's a very different language from English. It's not
Yes.
same as English. It's completely different.
Mhm. Okay, good. And um, my audience often asks me about wages, especially for consultants in the UK. Uh, would you say it's kind of good wage enough to live comfortably? Especially, I know you have children and all.
I think it's when you say it all depends on your lifestyle.
Mm-hmm.
As a consultant, you have more choice to find ways to increase your income. So I'll talk about that. But I think as a trainee, you earn around 200 2,500 pounds for to 3,000 pound around that you earn, and then it goes up and up slowly when your training years are going up. So slowly, and depending on how many on calls you're doing, your wages will go up and up. Around consultant time, you earn around, whether as a young consultant, maybe 4,500, 5,000, something like that. It's not that massive difference from a trainee, basically. But then there are ways to increase your income. As a consultant, you can work extra, you can work private, you can work, you can do some assessments, some reports, things like that. There are different ways to increase your income. You can work outside your clinical area to actually make more money as well.
Mhm. In old age psychiatry, is there much opportunity for private work?
Yeah, I think private work is always there. Things like a lot of old age psychiatrists interested in doing dolls assessment, mental health assessments
Mm.
outside their working hours as an independent doctor. Then you can work for tribunals, you can work for SOAD as a SOAD, which is a second opinion doctor as well.
Mm.
Then you can do clinics as well, outpatient clinics for private companies. And that's something people have been doing. Then you have some private hospitals which will actually pay more than NHS, and then you can go, if you don't want to work for NHS, you can go and work for them as well.
Mhm.
And then if you locum is another thing. If you by the time you become a consultant, you have ILR or British nationality, so you can actually, if you want to make more money, and then you can work as a locum, that will give you hourly pay rather than a monthly pay.
Mhm. Okay. And I also wanted to ask, so I have a lot of kind of people I know that they finish training, for example, in Turkey. They are consultants in psychiatry in Turkey, and they come here and they are considering CESR route. But alternatively, they could apply for ST4 training and then do the CCT route. Like you might know people who done CSR route, so I wanted
Yeah.
to ask you like advantages and disadvantages of choosing either.
So I think I would always say to people, if they can do CCT or training route, take the ST training. I think I still think that is a much better option, because since in training you are exposed to different teams, different specialties, different areas, and then you learn from them. So for example, when I was doing my training, if you combine my core training and my ST training, I've at least worked under 9 different consultants and 9 different teams. So in core training, I was changing my job every 6 months, and ST training, I was changing my job every year. And I've gone through different teams, different working environments, different working cultures, different subspecialties, different hospital, different trusts. So now you can say this was a big hassle because I'm moving between the trusts, and every year, every 6 months, I'm changing the job. But imagine the amount of knowledge and experience I was observing. If I was working in one place only for the 9 years, I will not have that degree of experience. I think that will I will become more comfortable, and I only know what happens in that place. I won't have the experience of understanding what else is going on. Uh, so people coming from abroad, I think if they have done MRC Psych exam, I would say I will always encourage them to go and apply for SC training. They can get the certificate C sign. They can, because of MRC Psych, they can get their GMC registration as well. The reason for that is, if you go to the Caesar route, it will take you equally long time anyway. Caesar is not something that you can get like this. It will take you 2 to 3 years to actually gather that evidence. And even then, they might not accept it. They might accept it. There might be few things which will not be there, and you sometimes might have to go to a lot of hassle to actually gather that evidence. So if you are on the ST training in 3 years, you will certainly get to the special register anyway. So it's much easier, I think personally.
Mhm.
So to explain to people that what is CESR, CESR is basically a non-training route. Basically, you are trying to prove to GMC that although you haven't gone through a structured training program, the trainees who've gone through structured training program, GMC is happy with them. They're signed off, so they can become consultant. GMC is happy to put them on their special register. But you haven't done that. So in CESR, you are trying to prove to GMC that I have actually not done training, but I have done exactly what trainees do. So you have to gather evidence for every aspect. This is just a very simplistic explanation to CESR. So they will ask you for exams. So if you have done MSS exam, or if you've done an equivalent exam, they will ask you what have you done. If trainees do on call, so what have you done to do out of hours assessment? So you have to give them that evidence. Then they will ask you about your job role so far. So you've done outpatient clinic, have you done inpatient, have you done this, have you done that? So when they want to make you consultant, they want a well-rounded up person who can take any job and work privately as well. So they like to see all that evidence. So again, as I said, it's much easier when you're in training. You will just automatically get that because you are going through that phase. But in Caesar, you have to gather evidence for all of those things.
Yeah, I agree. I mean, obviously, I haven't gone through Caesar, but like from what I heard it's very difficult. You gather like 1,000 page
Yeah,
documents or something like that. Um, and in the beginning, you mentioned about the MSc. So
medical education. Yeah, I did my MSc in
yes.
medical education.
So can you tell me a bit more about that? And like, would you recommend to like other people or in psychiatry training to do something like that?
So I think when after psychiatry so far only has the MRC Psych exam. So once you first finish your MRC Psych exam, you just got your SC training left. So you don't have any other exams. So I always encourage people who are in the SC training to think about something extra that they want to do, because that's a good time. Once you become a consultant, life could be a bit busier. So MSCs could be done in different subjects. I chose medical education because I was interested in education. Again, IMGs might face a little bit difficulty here, because if you're not British resident, you might have to pay the international fees for the MSc. But by the time I was in SC training, I had British passport, so I didn't have that problem. Um,
Mhm.
in the masters I've done is MSc itself was for 1 year if you done full time. It had 6 modules, and then you have to write a research article. Um, so uh, if you're doing this full time, you can do it in a year. But I did it part time, so I did a year, and then it was a 3 year course. So I did 3 modules in 1 year. Then I actually took a year off because I thought it was getting too much, and then I did another 3 modules for uh, another year, and then I wrote my master's.
Mhm. And now, like, what kind of things it help you to do? So, did it help with like academic work, or do you start doing any medical education?
Yeah, I
Um,
think it's helpful in so medical education. If you want to become an academic, it is very useful. So if you want to teach in the universities, if you want to take up any formal role of teaching and university work, it is very helpful for you.
mhm,
It's and I think I for me it was just my personal interest because I wanted to learn about more about education. That's why
mm,
I was doing that.
mhm,
But definitely I know people who have actually who have done MSc, for example, medical education, and then they took up a role with the medical college, with the medical school. So they became part-time consultants, clinical consultants. They only work part-time in the clinical environment, and they do rest of the work in the medical school, which is a paid job.
mhm. Have you done like any lectures in the medical school? Are you?
Yeah, I am
Mhm,
on their regular panel. So I do a lecture on the old age psychiatry, role of old age psychiatry, managing Alzheimer's dementia.
mhm,
Um, we do that is a rolling lecture. So every year I have 3 times a year I go to give the same lecture over and over again. So a different set of medical students come to attend that lecture after every
yeah.
3 months. And then there's some courses by the our deanery, and I go and teach on them as well. I've taught on my MRC Psych course as well in Wales, which is part of our training. Our trainees attend that, and I've also taught on other local programs as well. Personally, in my personal capacity, using my trust resources, I've arranged conferences as well, courses, training courses. So it just gives you those skills to actually go on and do those things.
Mhm. And I know you also are MRC Psych examiner,
Yeah,
right? Um,
and also PLAB examiner as well, and examiner for the medical college. So the 3 different types of
uh,
examiner.
Also, now they finished the interviews, but I hope they're gonna return back. So the core training entrance interviews, you were doing them as well, right?
Yeah, I was doing them. Yeah, when they
Yeah.
started.
Yeah. Um, so with all these roles, for someone who becomes a consultant psychiatrist, would you advise do you enjoy them?
I think it's about interest, because I think I find people have different interests and different values and different way of working. You will find consultants in NHS who will just do clinical work and don't do anything else. They're working there comfortably. There's no problem. And if somebody wants to do that, that's fine. Then there are people who are more academic. They are interested in academic activities, so they will do research. They will do all these activities to teach and all these activities to arranging conferences, seminars, and all those sort of things. Then there are people who are more interested in taking up some formal roles. So, as you said, becoming a CAX examiner, Royal College examiner, examiner for GMC, examiner for medical school. And there are other roles as a consultant you can pick up as well. You can work for Royal College as well. You can become a chair of one of their sub division.
Mm,
You can fight there. You can go and contest their elections and become take some more formal roles in the Royal College of Psychiatrists.
mm,
You can also with their local as well. There are certain roles you can go for as a consultant. Like you can become a training program
mhm,
director. You can become a course supervisor there.
mhm,
So there are different things that are happening in different aspects.
mhm. Okay. Um, and maybe I should have asked this in the beginning, but I forgot. People also ask me a lot, like, why not USA or why not Australia? I'm sure you would have considered that as well. Like, I wanted
Yeah.
to hear your answer to that, if that's okay.
No, I think they are good options. I wouldn't say they're bad, and where USA is very good. People who've gone to USA, they've done really, really well. My own classmates and the doctors I know. Somebody I know who, when I was training, I was reading for MRC Psych exam, and he was saying to me, he was a friend of mine. He was saying to me that I'm going to do US Assembly and going to US, and I'm not going to do MRC Psych. So when we were actually putting all our efforts and energy in MRC Psych, he was actually doing US Assembly while working in NHS, and he did that, and he went to America. So I think it's pretty good in America, to be honest. Their training is a bit shorter, but you can do fellowship after training, their basic training, and then their salaries are much higher. They save more money. You'll find in a lifestyle they have more money, more savings. You'll see them living as a more posh life than the British doctors. There's no doubt. Uh, Same with Australia. I know a lot of doctors who moved to Australia. An advantage of moving to Australia is like if you have trained in UK, that they sort of they can consider you as an equivalent there. So you can move to Australia after get their registration, find a job there, and move there quite easily, and then you can find the visa as well. And as you know, in psychiatry, there's shortage everywhere. You will, and they again they get paid quite well as well in Australia. I personally, I'm more settled here because I got some family here as well. So as you were mentioning the work-life balance, moving country means that you kind of leave your support system behind completely and to move to another country. So I have family here, so it gives me with my family, with my kids, this give us that support network, and I don't want to lose that if I suddenly move a country.
Sure. But with hindsight, after graduation, like, do you ever think like it would have been better in USA, Australia?
I think when I was, because I was from relatively a middle class family, so going to USA when I was actually uh, training or in the medical school, it was a costly thing. UK
Mm,
was much cheaper in that sense. PLAB 1 and PLAB 2, the fees wasn't that much, and just a plane ticket, and you after passing PLAB 2, you can start finding a job easily. The thing we were watching from our seniors was that you spend a lot of money, was spending a lot of money to do the US exams first, and then going to US was costing them a lot. And then they had this thing about matching. They apply for their residency, and some people get matched, sometimes people don't get matched, and then they have to wait for another year. So I was feeling that there was more investment of time, more investment of effort, maybe more investment of money. um, and I felt at that time that UK was relatively easier, and I probably it is still easier. I don't know if it's still the same, but that time I felt
mhm,
these two pathways were in front of me. Australia I never thought of, to be honest, because I didn't have any friends or anybody I knew who was in Australia at that time.
mhm. Yeah. I mean, for example, personally, I'm happy here because it's not too far to Turkey, and as you said, the entrance to starting to work here is much easier. In USA, you don't know where you're gonna match. Can
Yeah,
be anywhere in USA. I guess, as you said, like everyone has different kind of circumstances, so their
yeah.
choice might be different. So lastly, any other tips or insights for IMGs in general or people who want psychiatry? Any last words?
So I think IMGs who watch these our videos or thinking about UK, I think sometimes they find the whole process very overwhelming. And I feel I meet a lot of people who say, well, I want to come to UK, but I don't know where to start. I just want to say to them, I always say to them, then everything starts from the first step, which might be a very small step that you just pass your English exam. The second step is, yes, you start to find a date for PLAB 1 and do that. If you are coming from the MRC Psych route or the route of doing MRCP or MRCS, and you do so, all of these steps, they look overwhelming. When you see somebody working here, you think, how have they done all of that? But we all started from one single step. When we took the second step, then the third step, the fourth steps, just be uh, be focused on those steps. When you are going through one of those steps, focus your energy, focus your time on that, and make sure that you do it well. And then slowly and gradually you will get here as well, and finally you will get here, you get settled as well. But it is just it is all doable. People like me and you won't be here if it was difficult. Especially me, I was a very average student from a middle class family. So if I can come here and work here and become a consultant, then I think anybody can do that, as long as they are
I
they
think
are
you
moving in
you're
the
a
right
bit
direction.
you're being a bit modest, I feel. I mean, I can see that you're always very hardworking. I mean, you're always so helpful as well. I just want to thank you again. Whenever I ask you any insights, like you were always so generous with your tips and time. Thank you so much, really, on behalf of all the IMGs.
Thank you.
Yeah. Thank you so much again for this interview as well. It's been so helpful. Anything else like you wanted to say?
No, it's fine.
No.
Thank you.
Okay. Thank you so much.